So yeah, my name's Cassandra, and we're lucky to have some leaders from the mental health professions from different psych bodies across the UK joining us today. I'll be chairing this session, and I'll have to be quite strict with time. So if I come in, uh, it'll be around the 5 minute mark for each of you. So it's not to wind you up, but it's to wind you down. So if you hear my voice, please just finish your sentence, just because there's so much to cover. And I think, yeah, the excitement in this room and all the passion that's in this room means that we have to do something going forward. So this is just the start. But I'll invite Roman to come in and share based on the questions that I'm putting into the chat. So 5 minutes over to you, Roman. And if you hear me, uh, please wrap it up.
Thank you, Sandra. That's a real challenge to say what I have to say in 5 minutes. I really have to sort of first of all acknowledge the comments made by the people with young people with lived experience, and with Rachel as well. Really powerful statements, I think, which I will only echo. I think what they were saying in terms of what needs to be done within the education system. I think we can't consider mental health without thinking about the wider social context in which mental health is occurring for children and young people and adults as well. We have to acknowledge the current social impacts of the cost of living crisis, socioeconomic pressures, the pressures on children with special educational needs, including learning difficulties and diversity, neurodiversity, both diagnosed and undiagnosed, that present a range of challenges in the school environment. The impact of multicultural society, the positives about multicultural society, but also the needs of children whose English not as a first language, and how that can impact on their learning and their well-being within the school setting. I think the many challenges that children are facing in society, in terms of conformity, in terms of being socially accepted, the impact of social media, all impact on children in those settings. So we have to kind of think about those when we think about the children's needs and their emotional well-being needs. I think seeing all the challenges that are there, it's little wonder that children do suffer and struggle with emotional and well-being needs within the school and with the wider society setting. I guess our belief really is that every school and college should adopt a whole school approach to promoting emotional health and well-being. Schools should be environments that provide students with resources and support to fulfill their learning potential, not just for academic achievement, as some of the young people said already, but a safe place to learn and grow, to feel valued, to focus on both academic but also non-academic achievements and pathways, and to develop social and emotional life skills. We do have psychological professionals in schools, clinical counselling and educational psychologists working across health and social care, but we need to have this joined up, a multi-agency joined up, working better with frequent communications between system partners with a shared set of priorities. We also acknowledge that there is inadequate resourcing professionals, that we know there are workforce shortages. Our recent survey by the BPS found that something like 70% of respondents felt that children and young people didn't have access to educational psychologists, really important in terms of supporting in the school situation. Someone mentioned in the chat about mental health support teams. We know they've been in place since 2018, but there's still only half the numbers of mental health support teams in place that are required. It's also important to recognise the staff well-being as well, and the importance of how we need healthy staff in order to provide support to children. So in terms of what we need to do as professionals, encourage interdisciplinary collaboration across from the professionals, teachers, school staff. Look at educational psychologists in place in every school. Really important to provide that support in a school setting to really kind of address the needs that the young people mentioned earlier on today. To look at shared goals and objectives for emotionally nurturing schools for all children, to acknowledge and support children with additional needs, that may be learning needs and neurodiversity, and ensuring the adjustments are individually designed and in place for those young children. Looking at mental health professionals providing support to school staff on training around things like mental health first aid to recognise early signs of distress, looking at cultural competency, neurodiversity awareness, and also other professional developments as well. To look at a whole school culture that's there, to look at the school being a safe and supportive setting, that mental health intervention should be timely and at an early stage, not wait until things are at crisis point, but how can they be intervened at an early point in the development of the needs of the individual. And I think what's really, really important is collaboration with families and communities, that the young children shouldn't just be seen in isolation, but actually how professionals can work with families to destigmatize. And again, I think Dylan mentioned about the stigma of receiving mental health support, but actually by collaborating with families and young people, we'd actually then make it not a stigma to be seen by a therapist, but actually an important part of the life process. And I think evaluation on what's been done as well. I think to evaluate what is there that has shown what can be demonstrated to be an emotionally healthy school, and get feedback from students as well. I think we have to listen to the young people. Their voices are really powerful and important. We hear their voices can help us all to learn to do what we do as professionals in a much better, more person-centered and effective way. I think it's about my 5 minutes, Cassandra.
Yeah, wow, I'm so impressed. Yeah, you're right on time. So thank you so much, Roman, for coming along. And I know you have to head off, but if you do stick around, we'll have a bit of time after the panel for discussion. So if you're still here, we look forward to hearing a bit more. And now we're gonna go over to Lynn.
Apologies, I was just trying to unmute. I think, can you hear me, Cassandra? Yeah, and everyone. Yeah, goodness, I'm so touched by the earlier speakers, incredibly powerful, all of them. And as a parent who had, school children many years ago, I can absolutely relate to her terrible, terrible story. And I really hope there's something we can do collectively to support Rachel and others, children, young people, and parents like Rachel, to possibly even make a film with the support of various groups, bodies, whatever. But it feels like something needs to happen. And great to hear, Rachel, that you might be standing as a counsellor in Hackney. So, yeah, so I work with British Association for Counselling and Psychotherapy. We have in our body a number of people who work with children, young people in school settings and in other areas as well. And I think many of them would really kind of come on board with what I'm saying now, which is that children and young people, they're precious, they're absolutely precious, not just to this nation where this is being hosted, but to all nations. And they are our future. They're our future, and they're the foundations of future generations too. So the current scenario where we have cost of living crisis, which is still very much a live issue for many families, and not just in the UK. The social media scenarios, so we've got financial challenges facing parents and children, poverty, we've got health inequalities, we've got social, cultural, other inequalities that children are subjected to through being young citizens in our societies. And I'm saying deliberately societies because we've got a lot of different people in the call, and I think we had someone from Hungary and someone from Malaga. So we've got people from different parts of the globe. So what I'm saying in terms of social, cultural, political, geopolitical, it plays out across the globe. I absolutely agree with Roman that teachers need support too. I think some of the behaviour that Rachel was talking about that was taking place in the school setting, it needs opportunities for teachers and staff involved in schools to understand the needs of the children, the young people, and the parents. So I'm weaving through scenarios, but also some of the possible solutions, but I will come back and end on solutions. So some terrible stories that play out, and I've had experience of working with groups in primary school, final year of primary school, and from 11 to 14 around domestic abuse, and some of the terrible stories that have come through about the disconnect between the challenge that the parent might be facing and the child might be facing, and the way that the school engages with that traumatized family, essentially. And when I say trauma, I mean authentic ways of dealing with trauma, not, somebody mentioned earlier, buzzword. So authentic, compassionate ways of dealing with children and families who have been traumatized. And I think in terms of what we need, I think some of my learning is that we have to work across organizations. Schools can't do things on their own. I think a little bit of defense of schools and school teachers, their agendas are huge, and they have to tick so many bureaucratic boxes, when actually what we need is a bigger focus on relationships, on compassionate context, creating compassionate contexts, and involving young people and parents in developing solutions to the challenges that are faced in school settings. Emotional well-being and mental health should absolutely be a priority in schools. There's absolutely no doubt about that. And there should be a range of offers and support. And I'm thinking of Dylan here when I'm saying this, that sometimes counselling, and if there's just one school counsellor, sometimes counselling isn't enough, or it might not be what individuals want. They might just want a cuppa and a conversation somewhere. So there's something about the role of the kind of mental health professionals and counsellors and therapists working in schools to step outside of working on a one-to-one or a small group basis to be able to offer the kind of support that the school, the children and the parents need. And that could look quite different from how it looks now, given the opportunities and giving attention to consultation, collaboration, and some co-design and co-production. Absolutely essential. And I think the more and more that we realize that this is not an issue that individuals can fix. This is an issue that we need to work together. And I think there's a call coming through from the Therapy and Social Change group that we can pull together, we can do things that will be compelling and have impact. And that takes me right back to what I was saying about Rachel. And Rachel's story needs to be in a film and seen by lots and lots of people. I think that's about it. Thank you.
Yeah. Perfect place to wrap it up, and thank you so much. It's this idea of just stopping this siloed way of working, and actually what does it look like to come together and work across systems. I'm definitely here for the film, kind of sharing these stories and getting these voices out there, because I think that's how we'll make the change. So thank you so much, Lynn.
Yeah.
We're going to move on to Giles now. So Giles, please come in and share your reflections.
Hi, good afternoon, good evening. A few reflections, and I am conscious of time. For me, first and foremost, we as a profession, but as stakeholders and government, need to listen to children and young people and to parents of children and young people. Too much policy is written by government, I think, about enough consultation about what young people actually need. So that'd be my first point, and thank you so much to the speakers today. I don't want to make this about my organisation, but I'm going to say three things which we campaigned on recently or talked about in Parliament, which I think links in. The first one is to make sure there is a counsellor in every school, amongst other professionals, amongst child wellbeing practitioners and other higher and lower intensity work. And for that, we do have mental health support teams in schools, and we advocate for the Barnardo's model, which has a plus on the end, and a plus being to have a counsellor involved as well. Within that, though, we believe that MSHTs, mental health support teams, should be allowed to have a level of autonomy to work with the needs of the school and the area they're working in. And rather than, as I think one of the speakers said, rather than having a one-size-fits-all, they need to have that autonomy within that. The second one we really advocate for is to make sure that mental health services are designed to support relationship building. And too many mental health interventions are short-term and prioritize financial gain rather than actually long term and building relationships and building young people who've got resilience for the future. So that'd be my second point. And the third one really was to allow autonomy and choice, to allow young people and people at school to not be told this is the intervention you have to have, but to actually say which one actually is going to work for you. And that's why mental health support teams should have different professionals in them. They shouldn't just be counsellors. They shouldn't just be child wellbeing practitioners, etc. It should be an absolute mix of all of the above. So with that, I'd say, with Jimmy's point, but one size doesn't fit all. Couldn't agree more. And we need to design systems which are flexible and available. It sounds to me, I think it was in 2016, there was a government blueprint for counselling in schools, and they recommended counselling in all schools. We're now a decade on, and a lot of schools haven't even got MHSTs in, have got zero provision. So I just feel I wish we could actually push and get ring fence funding to actually make these changes, because I've been on a number of these calls, and what upsets me is a lot of us know what we need to do, and it's really how can we link together as professional bodies, as parents, as children, and actually speak together, because we know what needs to happen and how it should happen. Going to Luana, who said there's not enough support, I couldn't agree more. Saying having one counsellor or one mental health support team looking after 20 schools and you get a third of a day a month or whatever it may be isn't adequate. You need to make sure there's adequate support. And that really links in with what Rachel was saying about, we do have the systems, we do have some great ideas, but how can we make sure everyone has that? In my local area, Devon, they're about to instigate a system with 4 pillars in their education and SEND system, which says let's include parents more. That's as one of the key pillars. So why isn't that everywhere? Why is it always just one area that gets these benefits? And the last one I'd like to speak to, as I'm more of time, is Dylan's comment on confidentiality. And that is something I'd say our profession, and I saw someone put it in the chat, does struggle with the safeguarding needs of a school versus the confidentiality of the client. And I haven't got the answer today, but I absolutely agree it's something our counsellors come up against time and time again, and actually in many cases divulging information to the school is not the best interests of a child. And how do we balance the safeguarding rules of a school with the needs of a child? That's my soapbox moment. Thank you.
Thank you so much, Giles, and we're grateful that you came on your soapbox with us today, because I think, linking back to each of the lived experience panelists, it really cements each point. And it's that, how do we come together now and try to have somewhat of a collective voice to push this over the line? Because it's amazing, all of us doing great work in our own little bubble, in our own little remit, but what would it actually look like to come together? So hopefully that's some of the action that can come off the back of this call. So we're gonna move on now to Jocelyn, last but definitely not least. So thank you so much for joining us, and thank you.
Well, thank you. And thank you to Luana, Dylan, Jummy, and Rachel, because I think what they've pointed out to us so clearly is that education is in crisis. And we need a really serious campaign to make a difference, to be transformational, because we are in crisis. I think the professional bodies have worked for over 3 decades, and I'm really pleased that they're working more closely together since scoped. I think it's exciting to have a new partnership of counselling and psychotherapy bodies forming. And this is a great step forward for unity within the profession, because we really do need to be able to collaborate across those regulatory bodies. I've been involved with this process since the early 1990s, with the start of the Place to Be, and I've worked closely with Camilla Batman-Gelidge over 3 decades to try to create more integrated services, therapeutic services within education. I'm not the formal representative of UKCP today, but I have been invited because I've been working in UKCP since 1995, setting standards in training,
education, practice and research. And I am really impressed with the way in which the field is moving as a whole. I think the BACP Children and Young People's Competencies Framework is really inspiring. And I think the NCPS new register for work with children, their training standards and practice guidance is absolutely excellent. And I'm really excited that we are able to start to really work together with this vision, which really is essential. So what are the asks? I think we do need to apply the insights from therapy to education so children can access the curriculum and participate more fully in emotionally regulated classrooms and in the culture in schools, which is as much for teachers as it is for pupils. We do need the participatory voices of young people, and all asks must be inclusive of the youth voice. As Patrick McGorry suggests, children and young people should be involved with the design and delivery of services. A Young Minds survey, 5,000 young people said their top priorities were social media, sexual pressures, lack of access to help, school stress, bullying and unemployment. They wanted provision to be accessible, joined up, transparent, flexible and participatory. I think that the help needs to be in the contexts where children live, learn and play. And I think education is really well placed for this. How can we make working together a reality? Well, collaboration in interdisciplinary practice does need time, and some of the ethical and legal complexities have been highlighted there around confidentiality, also prioritizing contextual safeguarding. There needs to be, I think, an independent forum, somewhere where they can coordinate agreement between all the different stakeholders. The reason for that is that commercial pressures can lead to a kind of toxic competitive culture that's not conducive to the course. And competition can, in fact, lead to protectionism around work with children. And I think that really needs to be thought about a lot more carefully. How do we create a space that has different conditions for collaboration between different stakeholders? That joined up collaborative working with independent facilitation and investment will enable people to work together and to ensure they're not working against each other. So really, what is education? What should it be about fundamentally? I think the World Health Organization answers that question very, very well. Developing the skills for life, creativity and dynamism, the ability to develop potential and work productively and creatively, bring strong relationships with others and contribute to community. In summary, I think that emotions exert an enormous influence. It's an invisible and tremendous influence on all our lives. And there was a time when once we didn't know about the impact of invisible germs on public health. We now understand their effects in terms of illness and disease. And similarly, I think adverse childhood experiences, unprocessed emotions exert an impact on the well-being of children and young people and communities. The story goes that it was an initiative by ordinary people who first drew up the plans for the London sewers. This was way in advance of the government, and they'd been planning and working on this for 40 years behind the scenes. It was only when Parliament could not sit anymore due to the stench from the River Thames that these plans, which had already been drawn up by the people, for the people, were actioned and implemented. And I think there's a really powerful allegory here for all of us, because really, I think that the stench is now reaching Parliament. I think we all understand how important the sewers were as a public health intervention and initiative. And I think we need something equivalent around emotionally nurturing schools. We know, for example, that these stories we're hearing today of self-harm, And suicide rates, we know that youth violence is reaching a crisis point, and we've got to get really, really much more serious about this collaboratively and collectively in the form of campaigning. The professional bodies, I believe, are ready. They have the standards. We have, as Giles said earlier, we know a lot of the answers to these issues. We've been working on them for 3 decades now, and we need to be able to move much more effectively and strategically towards implementation. And to that end, we need a much more coordinated effort and strategic planning to achieve it. We really do have to do this now for generations to come, because if we don't do it, the public health crisis is really going to impact the safety and well-being of all our futures. So that depends currently now on our responsiveness to this situation. Thank you.
Thank you so much. And that metaphor that you used at the end there, I think really just brings it to life. And some people in the chat are saying, yes, there's a stench for sure. You know, it's here now. So it's what are we going to do with it? And the power of what it could look like to put our heads together and try to make some change. So thank you so much. I love what you said about emotionally regulated classrooms, which I think shifts away the responsibility from the individual student to this collective whole. And I think that's incredible. So we have about 10 minutes together to be with the panelists and ask some questions. There was a question in the chat that was directed at Roman, but I would invite the rest of the panelists to come in and reflect on this too if you have some thoughts. But again, just being mindful of time. So we have until 6:20 together. So thank you so much. So the question that came through was around, it was to Roman, but there might be some insight from others. If you have any involvement in the government's efforts to get the Children's Health and Wellbeing passed or amended.
I did respond in the chat there. I mean, I think that's it's going through the House of Lords at the moment, so it's going through that sort of second lot of reading. So I have very little influence in that area, I have to say. I wish I did, but I think no, not directly. I don't know if anybody else had any involvement in the bill at all that's on the panel.
We haven't been directly involved apart from writing in suggestions, but we have, through partners, including PACP, working with the Children and Young People's Mental Health Coalition, put forward a lot of recommendations throughout the time. That including the UKCP as well in that. So I would say through the partner organisations we work with, we have tried to affect change as opposed to directly.
Yeah, Lynn's on mute.
Yeah, I was just going to say that we have with us here today, we've got Jo Holmes, who has done a lot of work and lobbying around children, young people, and particularly in schools context. So I wasn't sure where Jo was on the call. She might want to comment on that, Cassandra, if that's possible.
Yeah.
There she is. Yeah.
Hi. I wasn't sure at what point I was coming in. I had so many comments.
Yeah.
Throughout. I mean, we're doing quite a lot of work behind the scenes and talking to ministers, sending letters, trying to put pressure on various departments, across government departments, around, you know, particularly raising the profile of where counselling fits in with working with mental health professionals in schools, with Mental Health Support Team Plus, which Giles was mentioning, which we would also strongly back. A lot of what Giles was picking up is very much, you know, the direction of travel of BACP as well. We're sort of collectively trying to find a space, a workforce space, if you like, for the counselling and psychotherapy profession. At times it falls on closed ears, for want of a better expression, and we try to get in with all the various like wellbeing bills. Interestingly, the wellbeing bill has no wellbeing in it. It's a very oddly titled bill. I would have called it a school welfare bill, because it lacks that mental health understanding, you know, that we're striving for. And one of the things that I wanted to comment on when we were talking about emotional dysregulation is I was talking to a number of Scottish school-based counsellors on Monday who were talking about teaching staff being emotionally dysregulated and support staff, and the conflict that results in, because you have to have well people looking after young people. And I think there's angles there that we could go down, like supervision for staff, supervision for safeguarding leads, supervision, I know education support, provide a supervision program for senior leaders. But then it's almost like we have to look at a whole reform of the education system. And there's some work going on with a Therapeutic Education Alliance at the moment, who are calling for an absolute reform on the 1988 Education Act to look at more therapeutic, emotional building in schools. And I think we've got a lot to learn from our European partners who don't put the early years pressure on till, you know, children are allowed to be, they're 8 years old before they have to do some of the things that our children are expected to do at 4, because of all the targets and all the outcomes that are pushed on, you know, teachers. So I think take that pressure away.
Thank you so much, Jo. And we're actually going to come to you again in the panel to follow. So it's really great to have your insight and expertise brought into this space as well. Giles, we're going to come to you in a second just to respond, but I have a question for everybody. Again, aware of time. So yeah, come in, Giles, and then I'll ask my question.
Mine was a really quick one, responding to something in the chat. Someone said it's not just about counselling in schools, and I couldn't agree more. And I know with colleagues like Jo, we're advocating for many things in schools, including counselling. So I do not see, I think I can speak, I see Jo and Lynn nodding. I don't think counselling is the magic thing which is going to fix everything, but it's part of the solution. And we advocate for the whole school approach, absolutely.
Absolutely. I think our profession, well, I say our profession, psychological therapists have to get to grips with the fact that there are many more people who work within the mental health landscape, and it's in our own interests and the interests of young people and everyone involved in schools to take on board the value of cross-organisational working and multidisciplinary teams. So yeah, absolutely right, Giles.
I do agree with that. And I also think that therapists and therapy has something to offer: therapeutic key working, therapeutic mentoring, therapeutic creative group work, reflective practice for teachers. The suicide rate amongst teachers is very, very high. And that's because they actually are experiencing the impact of the mental health crisis in our society. They're on the front line, and the countertransference and vicarious trauma is extreme.
Absolutely. We do have so much to offer. Sorry, go ahead, Lynn.
Could I add something in? I think what Jocelyn said is really important about the tension and the anxiety and the depression that the teachers experience. My neighbour is a head of a primary school, and from time to time she's really troubled by what she has to engage with in the school context in relation to children who are coming from terrible situations of poverty and arriving in school without, you know, breakfast, clean clothing, not be toilet trained. There's a whole range of different things that our young children and young people are being exposed to, and they're going into the school context with them as well. Schools can't do it on their own. They need help. And I know someone in the chat said about money. You know, where's the money for making change? And that's something that is very, very troubling, because we are terribly short of funding for education. So that's one for collective thought and taking forward collectively to look at with counsellors, politicians, where savings might be. I'll shut up now. Sorry, I've gone on a bit there.
No. It's so welcome. And it does lead into the question that I had. And again, I'm aware of time. I'm sorry for being the time police today. But, you know, the question I had was, how can the professional bodies that we have on the call right now here work more closely together on this topic? What would that look like? Not to put you on the spot.
I think today is a great example, actually, of how we've come together. We've not had any pre-preparation, yet some of our messages are really kind of coming closed in with one another, and with the young people's voices as well, and the parent voice as well. So I think, you know, events like this really help to kind of offer that opportunity, and I think we need to kind of build on that and to look at much more professional collaboration on an organizational level, as well as profession on a delivery level as well. And, you know, having these conversations, I think it's terrific to have today, the opportunity to share thinking. And here we're saying very similar things, which I think is really reassuring as well.
And Cassandra, I'd add, I think it already is happening. You know,
Yeah.
I know, I think it was Lynn mentioned of the PCPB, which is a bigger collaboration, but I know my colleague met with Joe recently from BACP looking at what work we could do together. So I think we're already saying, how can we work together because at the end of the day, we all want the same thing. We all want better outcomes for children and young people.
Yeah.
So, you know, I think the fact we're all here today, but I can tell you behind the scenes, we are already having discussions, seeing where we can co-campaign and push for the same things. We all want the same thing.
Yeah.
Collectively, we're
I think
stronger together. Absolutely.
Definitely.
Much more so, stronger together. And I think historically, I think people have got caught up with, I think what Freud termed the narcissism of small differences. And I think we need to go for a much broader brushstroke here and really coordinate and get on board together. And we need a forum for that to be active, because there are politics between the regulators and there are politics, I'm afraid, also within the regulators. There are 10 colleges within UKCP, and it would be really helpful if we had a capacity to collaborate across all of those. To represent the best interests of children and young people and have a formal representative for work with children and young people in the group, representing psychotherapy and counselling bodies. That would be fantastic. So we've got to, at Kids Company, they would say, you've got to get over yourselves. That's the main task. If you want to keep the child at the centre, first thing you have to do is get over yourself. And we need to keep the children's best interests at the centre and nobody else's agendas.
Thank you. And I think today is a really great example of this collaborative way of working. So we really, really thank you for coming and spending your Friday evening with us. It was really exciting to see just how responsive everybody was to come along and share today. And I think that speaks to the need and the timeliness of this conversation. So really, really grateful to have you all along. And thank you so much again for spending your time with us.